Hi, I'm Dr. Natalie Marks, and I'm here with another Fountain Report conversation. Joining me today is Dr. Mary Gardner, CEO and co-founder of Lap of Love. Mary, thanks so much for being here.
I'm loving this.
Well, we're here talking to innovators in the space, and of course, I'd love to hear just a high-level journey of how did Lap of Love come to be, and why is this such a crucial component of the animal health industry?
Well, Love started in 2009 with my business partner Dani McVety in Tampa. So it was one doctor, one location. And a few months after she was doing this as a part time as an ER vet, and then doing this, just on the side, I came in and I was ready to leave general practice at the time, and I just for some reason just fell in love with the concept of end of life and making it a little bit better for all the families. And that's actually my journey into veterinary medicine was a little unique. I was in the software industry for 10 years. And then the loss of my own dog is actually what made me want to go back to school in my 30s to become a vet. So I didn't graduate until I was 35, and I just did general practice for a short period of time. So the thought of end of life is not it's not a path that most people will pick, but it was one that just rung true to me. And her and I both knew from the beginning that we wanted it to be scalable and to be something that we could bring all across the country. And so in 2000 and I think 11 is when we started to bud into more than just Florida, where went into North Carolina, and we just kept growing and growing. So now we are close to 400 doctors, 200 people that just answer our phones every day. We get 13,000 phone calls a week, and we're helping about 150,000 families a year. And it's just crazy from how it got started.
Yeah, I think the really interesting component of this is that for a lot of veterinarians, end of life tends to have sort of a heaviness to it.
Yeah, it does.
And also, we often don't think about that as a way to bridge continuity of care.
Mm,
That sometimes we think that's an ending, but I think you'd probably disagree that's actually really a beginning.
yeah, it is the most important appointment that they will ever have, is that saying goodbye. I mean, the first one's important too, but the last one has to be done so well, and you could screw it up very easily. And I lecture a lot on how to make euthanasias better in the clinic. I don't talk about in-home euthanasia at these conferences. I talk about it where how can we improve it in the clinic. It starts with the phone call. It's, how do you have that conversation when somebody calling for, euthanizing their best friend? Like, it's a tough conversation, and um that impact starts there. And then it's how they're greeted, how they're, come into the clinic. Then of course the medical process of it is actually very small. It's the whole appointment is I don't want to say performative, because I don't want to it sounds a little negative, but it is. It's making the paw print. It's how to call them when the ashes are ready, who you're teaming with as a crematory. Like, it's the whole thing. And one little hiccup in that step could ruin the relationship you have. And I've done a lot of research with euthanasias that are done in clinics. And did you know that if a clinic euthanized one pet for that family, meaning that was their only pet, so they euthanized their only pet, the return rate of that family coming back to that clinic in 2 years is just under 10%. So you could lose families very easily with euthanasia. If though they were had two or more pets, so you euthanized one, but they at least had one more, the return rate is much better. It's 75%, but you're still losing 25% of families, and they have pets. And a lot of the reasons why is, sometimes things go not perfect, and it's not the medicine. We focus so much on the medicine. As a doctor, it's like, well, there's an agonal breath. Was there a seizure that happened? Like, all the things, but it's the whole experience. And I think taking it out of the clinic can actually help a clinic have that family return back. And we do see that. I've done also studies to see return rates if they've taken the euthanasia out of the clinic, and we can improve those return rates greatly.
So part of what makes Lap of Love unique, of course, is the fact that you've scaled this
Yeah.
into a massive operation. But what else would you say? Because there's quite a few people that are in the hospice and at home euthanasia space now. What makes your company unique?
Well, there's a couple of things. I think for B2C, so the outwardly facing component to the families, we are all about education and preparing them before the end We have a pet loss support group. We've got, like I said, our care coordinators that are answering our phones. They go through a 3.5 week training process before they're able to answer this one phone call. Like, we are big on training and process. And I have to tell you, the families that call us, sometimes they don't remember my name when we go to euthanize their pet. They remember Valerie who answered the phone. Like, I think that's what sets us apart, is that our entire team from beginning to end is so impactful for the families. But also for the veterinary space, the veterinarians that join us, yes, they could do this on their own, maybe, but it is answering your phone, it's doing collections, it's marketing, it's all those things. And veterinarians, those that have a little entrepreneurial spirit, can do this on their own. But those that just want to be good vets and go to homes where they enter as strangers, but they leave as everything. Like, and they could just focus on that. Joining us allows them to do that, where they could just be great doctors and we handle all the rest.
I love that you brought that up, because I also think that there is perhaps a bit of a stigma around euthanasia or end of life care, that it's one of course, sometimes the hardest part of our day,
Yeah.
right? In general practice. And it leaves us often heavy, or bringing that home. And some even have speculated that that's some of the reason for compassion fatigue and burnout. And I know where you're going to go with this. And I think it's a really interesting concept to hear about the satisfaction of the veterinarians in your space who
Yeah.
are doing this every day. What does that look like? And talk a little bit about the retention in your company.
Oh, okay. Oh my gosh. I love so many things of this. So I don't want to forget anything you've just asked me, because there's a lot of points to this. Okay, so yeah, euthanasia is definitely sad. Anybody who's not sad is probably not in the right job. Like, I cry even though I've done thousands of euthanasias, because this is a family member. We all know this. Um, and I will often say I can't be in control of why I euthanize, but I can be in control of how. And so, yeah, it might be a younger cat that's got diabetes and the family just can't manage it financially, physically, whatever. And it stinks that we have to do this, but I can do it really well. And so I leave actually very satisfied, knowing that I've done the best job. And I'll think to myself, like, oh man, I said the best thing. Like, the kids were there, but they were all involved and we were doing paw prints together. And I think if we can make it better for the family, they will heal faster and adopt again faster too, which is really important. So I can be sad, but it doesn't mean I'm compassion fatigued. Um, do I have do I have compassion fatigue? Everybody asks that, and for me, compassion has three ingredients. First, the recognition of suffering. Check. Like, I see
Mhm.
that. Two is the desire to change it. And that's the difference between compassion and empathy, is the actionable item to change that. And so I can help with the suffering. Not just the pet too, by the way. It's the family are suffering. And three is not being attached to the outcome. And so you have to be able to detach that part of it. And I think sometimes being an in-home euthanasia doctor, it's a little bit easier because I haven't had the family a part of my world for 10 years or 15
Mhm.
years. I'm this first time I'm meeting them, and they embrace me coming into their house, and then I leave. And I could pillow my head at night knowing that I helped that family. And that's where compassion is helping. And
Mhm.
we do. The people who have the most compassion fatigue at my company is actually not the doctors. It's the care coordinators that are answering the phones, because they are talking to them for 30 and 40 minutes sometimes. They hear the dog crying in the background. They hear the silence in the owner's voice because they can't talk. And if we can't help, compassion is wanting to help and being able to help. And if we don't have a doctor available this weekend, let's say, and they can't come till Monday,
Mhm.
70% of our phone calls need help today or tomorrow. And if we can't help, that's what makes them sad, is that we can't send a doctor out. So they're the ones that we have to make sure that we have things in place to help their compassion fatigue. I literally just got an email from a doctor last week, and because we do internal surveys and things like that. And she's like, I don't like how one of your questions was asked, because it was asking about their compassion fatigue before working with us and their desire to leave veterinary medicine.
Mhm.
She's like, you need to separate those two. I was like, okay, good point. She's like, because before Lap of Love, I had a 6 out of 10 for compassion fatigue. So I'm like, okay, and I was like, well, what is it now? She's like, 0. I love my job. I love it. And this all she does is 3 appointments a day, where it's just saying goodbye, but she does 3 amazing appointments a day, and she leaves with big hugs and big gratitude. So compassion fatigue is actually not an issue for our veterinarians.
It's so good to hear.
Yeah.
I'm going to ask you a hard question, and I can because we're friends. I think that there have been some practices or groups that are perhaps nervous or a little hesitant to partner
Mm,
with Lap of Love as an outsourced resource
okay.
because they're afraid of losing that in their hospital setting.
Mhm.
So what is your answer if somebody said, I know you're in my area. I don't know if I want to partner with you because I'm going to lose that client or I'm going to lose that revenue or insert whatever you want into that
Mhm.
worry or potential obstacle. What would be your response to that?
Okay. First, yeah, you will lose some revenue because we're taking the euthanasia and the cremation. Let's say it's $300. Okay. However, the families that get referred to us will always thank their vet that they did that, right? We are, veterinarians can do euthanasia. So it's not like a specialty, like a TPLO or, sending them off to the oncologist to do radiation, things like that, where the vet can't do that. But we do it really well. We do it really, really well. And so to send them to us is not, it's not a specialty, but we're experts. I can't even say that too, but we got this down, right? They're sending them to the best. And my studies have also shown, I looked at 14,000 families that were referred to us by doctors, that their return rates were actually 10% better than those that didn't. So remember I talked about the return rate. So you're losing families, but one way to actually get them back is referring them out to us because they will come back within that first year even, so not even extended out. So I think what's important is keeping that bond with that family after that euthanasia, and they will come back. They will also come back faster, and they will return to you and they will thank you. It's partnering with the best, and I'm probably biased. I know I'm biased, but I think it's a short-term focus if all you think about is that one euthanasia. Also, so forget about that on your P&L statement, but the impact it does have on your staff. Um, Doing the euthanasia, asking for payment. Nobody likes to ask for payment. Everybody struggles. They ask, Mary, how do you ask for payment in the clinic? It's not an easy thing to do.
Mhm.
Um, Running around and doing a euthanasia and then going into a 2-year-old dog appointment or a puppy appointment. It's hard for the staff to turn on and off. So there is an unmeasurable impact on your staff for these end of life appointments. And so if we can make it better for them too, like that's something that has a price.
We're excited to see the next chapter of Lap of Love with you at the helm.
I love
And thank you for all the disruption that you've done and all that you're doing for all the pets and the people that we love in our industry.
No, thank you.
Again, Dr. Mary Gardner, CEO and co-founder of Lap of Love. I'm Dr. Natalie Marks with another Fountain Report conversation. Thanks so much for joining us. We'll see you next time.